COVAX facility designed to distribute COVID-19 vaccines to low-income countries faces a serious challenge to meet demand. WHO Director General Tedros Adhanom Ghebreyesus says that last week he made an urgent request to countries with doses of COVID-19 vaccines that have WHO emergency use listing to share 10 million doses immediately with COVAX, while he said warning that the clock is still ticking on vaccine equity. Leila Mohammed reports.
Almost a year and a half into a global health pandemic that doesn't seem to be losing steam in many parts of the World Health Organization is expressing new fears of class segregation that the pandemic is revealing, especially in access to much-needed vaccines.
The clock is still ticking on vaccine equity. We have 9 days left until we reach the 100th day of the year, and the target of starting vaccine rollout to health workers and those at risk in all countries remains in our grasp. COVAX has already delivered 35 billion doses to more than 78 countries. But there is still a serious challenge on vaccine equity and availability.
Africa is currently experiencing a resurgence in COVID-19 transmission, which threatens to impose much heavier losses in terms of public health outcomes compared with the events of 2020. Most African countries have had little success in gaining access to current and future supplies of COVID-19 vaccines and find themselves at the periphery of the global scramble for inoculation. Some countries will benefit from their relative wealth, strategic importance to vaccine-producing nations, strong logistics offering to secure early access to vaccines through the COVAX facility, but most will rely upon collective bargaining and the goodwill of the international community.
Last week, I made an urgent request to countries with doses of vaccines that have to WHO emergency use listing to share 10 million doses immediately with COVAX. The extra 10 million doses would be an urgent stopgap measure so that 20 countries which are ready but haven't got the supply needed to start vaccinating their health workers and older people could begin before the 100th day, 10 April. I also requested manufacturers to help ensure that the countries that step up can rapidly donate those doses. This challenge has been heard, but we're yet to receive commitments for these doses. I'm still hopeful that some forward-looking and enlightened leaders will step up.
While scientists struggle to find a possible cure for the latest coronavirus, WHO says that it is yet to find a solid source of the latest pandemic-causing virus.
Of course, there are many recommendations made by the team from the report. I hope you have read the report. So there will be follow-up assessments. So that's what we expect. But we haven't yet discussed because the report was just released last Tuesday.
Epidemiologist Maria van Kerkhove said that Brazil was in a very serious situation as several states had declared emergencies and hospitals around the Latin American country were being overwhelmed. Assistant WHO Director General Mariangela Simao hailed Brazil's ability to domestically produce a vaccine as an important asset at a time when vaccine supplies globally are stretched. Director General Dr. Tedros Adhanom notes that local production is very important, while promising that WHO is ready to help countries achieve vaccine equity, and this could be addressed by increasing local and regional capacity in production.